So let me begin by acknowledging the traditional owners on whose land we're meeting in various places around Australia and I think around the world. We're here on Ngunnawal and Ngangri lands in Canberra, and I pay my respects to elders past, present, and emerging, and noting that we are on unceded lands, always has been, always will be. So I'm Sharon Friel. Welcome to Saving the World webinar series. We're just going to save the world. So the series comes to you from the Planetary Health Equity Hothouse, which is an initiative of a laureate, ARC laureate fellowship in governance for planetary health equity. And I'm joined today by Megan Arthur, one of the marvellous laureate research fellows. And each month we're joined by really just a fantastic guest discussing all aspects of planetary health equity, consumptogenic system, its structural origins, what it means for the intersection with climate change, inequality and health. And I'm so pleased today we're joined by Dr. Workman, from the Melbourne University, and Belle's going to speak about some really interesting work that she's done previously and I think is continuing to do around the political economy of health co-benefits in terms of climate change mitigation policy, and because as we know there's all sorts of opportunities when we think about mitigation policies for health purposes as well, but of course that's not a straightforward thing to do. So really, with no further ado, my delight to welcome Belle. Belle's going to speak for about 30 odd minutes, and then we'll have a discussion with her. We'll of course open up to yourselves, the audience. So over to you, Belle.
Many thanks for that very warm introduction, Sharon. I'm just going to share my slide deck. It's such a pleasure to be here today and to see some names that I recognise, and important, I suppose, to acknowledge that as an early career researcher, there's still a lot I need to learn, and I'm looking forward to hearing people's thoughts today based on what I share. For those who know my PhD work, there will be, sorry, I'm just trying to access my, there we are, start the slideshow. I will be talking quite a bit about some of the work that I did as part of my PhD, acknowledging that that was, submitted a few years ago now. And so really looking forward to a really productive discussion based on the presentation of some of my findings from my PhD and how that, I suppose, the implications for that in the current context with, a very different government pursuing very different strategies and I suppose, priorities. So as Sharon very kindly said, I'm an early career researcher, a social scientist based here at Melbourne Climate Futures and the Melbourne School of Population and Global Health at University of Melbourne. And I'm really interested in understanding how we can support the development of healthier climate and energy policies through the work that I'm doing here as a research fellow. So before I continue though, following on from Sharon's beautiful acknowledgement, I too would like to offer an acknowledgement of country and acknowledge that today I'm presenting from the lands of the Wurundjeri Woi-wurrung peoples of the Kulin Nation here in Naarm, Melbourne, and pay my respects to elders past, present and emerging, and pay my respect to anyone joining online today. I always, for those who have potentially seen some of my slides before, will know that I always include this quote from Pat Anderson, who you may well know is heavily involved in the moment in the Voice to Parliament, a quote from a book on Indigenous health back published in the 1990s, our identity remains tied to our land, to our cultural practices, destroy this relationship, and you damage sometimes irrevocably individual human beings and health. I think it's such an important reminder that our First Nations people understand better than anyone the incredibly important and inextricable link between the environment and our health. And we need to continue to incorporate as much as possible traditional knowledge in finding solutions to these complicated problems. So in terms of my plan for the presentation today, I'm going to start with a very, very brief and oversimplified presentation of health in the current climate change agenda, before I move on to talk a little bit about the political economy of health and some of the findings from my PhD, which use both the political economy of health and Walton Gilson's policy analysis and reform tool to really explore the political traction of health and specifically health co-benefits in the development of mitigation policies, and then turn my thoughts to, or the discussion to, what we might be able to learn from these findings in terms of securing healthier climate policies going forward. There we go. Excuse me. Before I continue though, I did just want to kind of, I suppose, set the scene from where this really all started for me. So prior to doing my PhD, I was working at the National Health and Medical Research Council, NHMRC, in first of all the clinical practice guidelines team, and then following on from that, the research translation team. And during my time at the NHMRC in 2013, the Australian Dietary Guidelines were published. And at the time, whilst I wasn't involved directly in the development of the guidelines, I was aware that there had been interest from environmental groups and environmental health groups about how the guidelines were going to address environmental factors and their influence or impact on, in terms of guidance on diet in Australia. And while, as I said, I wasn't close to the decisions being made at the time, I thought it was important or interesting that in the end, they were acknowledged in an appendix, Appendix G, which was developed to assist health professionals to discuss the complex issue of food, nutrition, and environmental sustainability with interested individuals. The aim would be to encourage people to review their dietary patterns with a primary focus on improving their health while allowing them to consider ways to reduce environmental consequences. So it's a 4 or 5 page appendix that kind of talks through a little bit about what we know, but I suppose questionable in terms of how it really informed the development or guidance around nutrition for the public, and I suppose nutritional health policy. And Sharon, I know that's an area of work that you have been heavily involved in, and so we'd be interested in your thoughts around that, particularly as I understand that we are, the NHMRC is currently looking to update and revise those guidelines. So maybe food for thought, pardon the pun, and something we can discuss in the Q&A part of the talk. So, as I said, this presentation will predominantly be focusing on some of the research findings from my PhD, which I completed back in 2019. In the 5 years since that time, there's been a lot that's happened. I don't need to really push on the point. Obviously, we've had a few major international and national changes that have had some pretty life-altering consequences for many people around the world, and continue to on top of climate change. But essentially, what I think it's fair to say is that we are seeing, as a result of these, increasing inequity, particularly for the most at-risk populations. And so it's within that context, I guess, an acknowledgement that while a lot has happened since my PhD was completed, I think that some of the findings are still particularly relevant given where we find ourselves today. So moving on now to the first section of the presentation, health in the climate change agenda. As I said, this is going to be a very oversimplified and brief overview. For those of you who are close to this area, you'll know probably a majority of this. So this is really, I suppose, for the benefit of those who might not be as close to this space. In terms of progress and political traction, I've chosen here, I guess, two graphs to try and demonstrate where we might be from an international context more than anything. So these are two graphs taken from the Lancet Countdown. For those who don't know, an initiative involving a consortium of researchers, political scientists, economists based in the UK, who since 2015 have been really tracking and monitoring our progress on climate change and health, including, I suppose, how that's integrated or thought about at across levels, both domestic at national levels, but also international levels. And so here on the left is a graph in terms of their analysis of the incorporation of health and climate change in the nationally determined contributions. So essentially country pledges that are taken to international climate change negotiations. And as you can see there, there's been a slight decrease in terms of mentions of health in relation to climate change in NDCs, but an increase in relation to mitigation, which is interesting. So this is obviously a high-level overview. The graph on the right is analysis of UN general debate and mentions of climate change and health separately, and then also at the intersection where climate and health have intersected. And I suppose, probably not surprising, I think there has been increased awareness, not in part thanks to the incredible advocacy and activism efforts of the health community and others who have worked tirelessly over the last few decades to really increase just basic knowledge and general awareness of, how health is relevant to climate change. And we're really starting to see, I think, that, follow through or see that play out in terms of the political traction that climate and health is getting at an international scale. Of course, though, just because we're talking about it doesn't mean that we're actually seeing progress or actually seeing, I suppose, fundamental changes in terms of climate and health. And those of you who are familiar with Climate Action Tracker will probably know the CAP thermometer, where they analyse country policies and essentially provide an estimate of what that corresponds to or correlates to in terms of degrees Celsius as a result of current commitments or pledges to emissions reductions. And so what we know is that we're still on a dangerous path in relation to human health outcomes based on where we're currently heading. This was last updated November 2022, so it's only a few months, 6 months out of date. But we're still, on track for a 2.7 degree warmer world, which for those who are medically trained know that is still going to lead to incredibly harmful health outcomes for a majority of people. So despite progress, we're not at a point yet where we can say we have developed or are implementing mitigation policies or climate policies that are healthy in terms of where we're heading. So I think it is important to have a definition about, when I talk about wanting to contribute to the development of healthier climate policies, what does that actually mean? Here's my first take on that. So this wasn't part of my PhD, but I guess something I've been thinking about and very open to feedback on whether or not this accurately encapsulates what we should be aiming for when we talk about healthier climate policies. So policies, programs, interventions that consider potential health outcomes with the intent to maximise these across population groups. And that, to elaborate on that, ensuring that we maximise health outcomes not for certain groups over others. So we're making sure that we're developing well-considered and careful policies, and often that requires a policy mix so that we're avoiding regressive policies and further exacerbating health inequities as part of that process. And also, I think acknowledging that based on existing technologies, there will be trade-offs or health co-harms. And as a society, it's really important that we need to make informed choices about which co-harms we deem acceptable. And I suppose to just provide a little bit of an elaboration on that, I'm particularly interested at the moment in the renewable energy transition and making sure that we avoid the mistakes of the past in terms of not being clear on what the negative externalities will be or could be as a result of decarbonisation efforts. And so being very clear about what potential health impacts we might look to see across the full life cycle of both current and emerging renewable energy technologies. There's no doubt that critical minerals, which are essential for clean energy technology, have an environmental impact and therefore a human health impact, and often, depending on where they're mined, can see the exploitation of labourers, workers. So I think it's really important that we understand that based on our existing pathways, there will be trade-offs, and we need to make sure that we're very clear about what those are, and that we look to mitigate those and protect health as much as possible where they're unavoidable. So looking forward to your thoughts and feedback on this as potential definition for what we should be aiming for in terms of healthier climate policies during the discussion. I wanted to provide an example of what unhealthy climate policy looks like, just to be very, I suppose, to clarify or to kind of elucidate on what we want to avoid. And I think actually the European transport sector provides a really useful example of what constitutes unhealthy climate policy. So back in the 1990s, after we agreed on the UNFCCC and at the 1992 conference, the EU set about looking to reduce emissions to decarbonise the transport sector. And one approach that they decided to, or avenue that they decided was going to be effective, was to shift from petroleum fueled cars towards diesel vehicles. And of course, there were car manufacturers involved in supporting or advocating for that policy change, as I'm sure you can appreciate. And then they used obviously a number of policies and interventions to really facilitate that shift. So keeping the price of diesel below that of petrol, offering tax incentives for diesel vehicles and the like. Now, obviously, the focus of that policy was decarbonisation to reduce emissions, which at the time was critically important. But in not thinking through the potential health outcomes, I suppose it's what ended up happening, and what we're now seeing, a number of decades later, is the negative health outcomes that resulted from that policy change. So diesel particulate matter is one of the kind of key byproducts of diesel fuel, as it is for petrol, but certainly diesel is particularly problematic when it comes to particulates. And so, fast forward 30 years, what we're now seeing based on 2015-16 estimates is the air pollution impacts from diesel across Europe amount to about 72 billion euros in health-related air pollution costs, 75% of which are attributable to diesel, and approximately 30,000 particulate matter and ozone-related premature deaths annually as a result of that policy. And interestingly enough, as of Feb this year, the EU has implemented a ban on new fossil fuel cars effective 2035 as a result of, I suppose, or at least in part as a result of the negative human health outcomes. So I guess an example of how it's so critically important that we consider health outcomes when we're developing policies. So moving on now then to the political economy of health, which is an interesting area of literature, and I suppose like many areas have differing perspectives or perspectives on a spectrum. So I think one of the more, I suppose, critical critical perspectives is around a person's value. How do we value an individual, and a person's value being dependent on their contribution to the production of revenue through their productivity or their labour power, which I think we can all agree is a morally repugnant thought, but something, I guess, that within the literature is explored as a perspective. In terms of my research, acknowledging that may potentially be the case, I think that it's actually more useful and helpful to focus on another kind of key tenet of the political economy of health literature, which is that we tend to consider under a neoliberal paradigm that individuals are responsible for their own health outcomes, and it's a result of lifestyle factors and choices that the individual makes that people end up sick. And what the political economy of health literature would argue is that is actually not the case. So very closely aligning with social determinants of health, that there are a number of determinants beyond an individual's control which impact their health outcomes. They might be political, they might be economic, they might be cultural, they might be environmental, commercial. So a whole bunch of determinants that impact an individual's health. And I think increasingly that is actually, increasingly accepted as being the case. So here we have from Dennis Raphael, the social determinants of health discourses, key concepts, which I have included here because I think it's important to note that as of this year, an 8th discourse was added. So only that final one, only under a post-capitalist democratic socialist state can the quality and equitable distribution of social determinants of health be possible, which I think is interesting and something that I'm keen to explore in a bit more detail, because I very much agree with the idea that there are many actors and discourses, narratives, institutions that do perpetuate health inequities, and we need to be looking at ways to address that. For me, this feels like the idea of a post-capitalist shift away from the neoliberal paradigm feels like the transformative shift that we will not achieve in any reasonable timeframe. So I guess for me, the focus today is really focusing on the other components of social determinants of health, although I think it's really important to acknowledge the need for transformative change, particularly when thinking through potentially shorter term strategies we can use to secure health benefits or healthier climate policies in the meantime. So with that in mind, I think I'm really going to be focusing then today in terms of, thinking through how we can use insights from the social determinants of health to support the development of healthier climate policies. For those in this space who work in this space, you'll be very familiar with this social determinants of health graphic, acknowledging that there are many determinants beyond our individual decisions or choices that impact our health. So I won't labour the point. As I've said, some dominant, under a neoliberal paradigm, dominant discourses, actors and institutions that I suppose maintain the status quo. And it's important to acknowledge that there will be winners and losers of healthier climate policies. So particularly if we're talking about mitigation policies and emissions reduction, the greatest winners are probably going to be those populations who are considered most at risk from climate change, the children, the elderly, those with pre-existing health conditions, First Nations people and the like. Whereas the biggest losers, as this is in no way profound, are going to be our extractive industries, potentially those who are, cannot or will not diversify, and who bemoan the costs associated with having to mitigate. I think it's really important to acknowledge that as it currently stands, the greatest losers are also those who wield the most power and influence in policymaking processes, which I think provides a particular barrier in terms of seeing us move forward in this space. So as part of my dissertation, I did a review of the literature and identified some kind of, I suppose, key concepts or domains in which I think are relevant for thinking about development of mitigation policies or climate policies and health. So in relation to discourse, framing historically has focused on the costs of action, and even in the UNFCCC framework, the agreement, the physical document, there's reference to distributed costs of burden sharing. So very much framing climate change action as a burden and a cost, as opposed to really focusing on the benefits and opportunities that it affords. I think what we've seen is, in terms of efficiency, is policy options that have been economic in focus. So very, preoccupation with economic policy options that are market-based, least cost have been prioritised and pursued and preferred. We've certainly seen that in Australia with an auction system essentially used to reduce our emissions through the ERF. Vested interests are obviously something that's important to acknowledge, and I've already mentioned that powerful stakeholders and actors influence policy development, and that's certainly the case in relation to climate policies and has implications in terms of health. And then I also found through my research that as much as a whole of government approach is increasingly employed to develop climate policies, the Health Department was still considered a periphery agency in policy development. So back in 2016, when I undertook my research and spoke with policymakers across departments, including at the Health Department, it was pretty clear that the in-house expertise in relation to climate and health was relatively minimal, but that there was also an expectation that if there were health considerations to be incorporated into climate policies, that it was the Health Department's responsibility to bring those to the table. So just sharing a couple of the findings from 2016, which is when I actually spoke with policymakers in Canberra, and this was under the Abbott government. It was very clear that the influence of non-state actors did have whether it's an undue influence, certainly an influence on policy development at the national level. So from one policy expert, business has a paved road rather than one they have to hoe themselves. They can get access to the Prime Minister and Ministers pretty much anytime they want to. And also an acknowledgement from policymakers back then at the time that talking about health outcomes wouldn't work in the context of the government's current policies. And certainly, when you're talking about auctioning or reducing emissions through an auction process, rather than regulating and being able to then be very clear and calculate the number of emissions you're going to be reducing, it makes it much more challenging to start thinking about health co-benefits, because you can't then quantify the types of health savings you're likely to see if you don't have a clear understanding of what type of mitigation is going to happen year on year. As I said, those were several years ago now that I had those conversations with policymakers, and we have seen change and potentially signs of progress in the last year or two under the current government. So cautiously optimistic about the commitment to develop and implement Australia's first national health and climate strategy, and particularly pleased to see that is being, or certainly that conversations are being had in relation to this strategy, being led by both ministers involved with the Department of Health and Aged Care, as well as DQ. So very positive to see that there is kind of cross-department commitment to the development of this. And then secondly, I suppose, akin to the wellbeing economy, a commitment from Treasury to look at measuring what matters and looking past those more traditional economic indicators to consider other, indicators that provide us with an opportunity to consider how Australians really might be progressing. So based on that, I wanted to talk a little bit about where we're at and how we might look to secure healthier climate policies, acknowledging that we're working with the status quo. So as I kind of alluded to earlier, a transformative change is certainly needed. We need to disrupt the dominant discourses, actors, institutions that really are kind of perpetuating the current status quo. And I really liked this quote from Rob White from a couple of years ago. He's a political economist down at UTAS. Climate endgame that we face, brought upon us by an endless pursuit of growth through capitalism and globalization, is the key dilemma of our age. And the equation is simple: you can't achieve transformation without fundamentally changing the ownership structure of the present political economy. So while I agree that the current paradigm remains tricky, I'm also, I suppose, a pragmatist and realistic that transformative change takes time. When I look at how far we've come under the current paradigm in terms of progress on climate action since the UNFCCC was established back in 1992, I'm mindful that these things do take time, and I'm an impatient person. So I think for me, it's important to start thinking about, well, what can we do within the current existing paradigm to try and move things forward. One thing that I think is, one example that I think is really positive, and this is, now a few years old. I haven't done additional investigation or exploration yet of the Biden administration's policies, particularly the Inflation Reduction Act, but I think that would be really insightful. This is taken from the Obama administration's mitigation policy development back in 2015. So the basis of their mitigation policy was the Clean Power Plan, which essentially saw use of an existing legislative lever, the Clean Air Act, to try and incorporate greenhouse gases as a pollutant that impacted human health and would therefore allow them to pursue healthier climate policies. And I particularly like this infographic because I think that it does appeal to multiple stakeholders and certainly attempts to, I think, appeal to business and industry who, as we know, stand to potentially lose from the implementation of more ambitious climate policy. And in particular in relation to being very clear on what the potential productivity implications of inaction on climate change are. So you can see there up to 300,000 fewer missed school and work days as a result of implementing the Clean Power Plan are flagged and highlighted there, let alone, important statistics around fewer asthma attacks for kids, fewer premature deaths. So appealing to a very broad audience there, parents and others who, health resonates with all of us. And also taking the time to quantify and monetize those potential benefits, which I recognise and acknowledge is no easy feat and complicated, requires local data and the like, but by no means should we shy away from that just because it's hard to do. Sorry, just checking the time. Thank you very much for that, Megan. In terms of enablers for developing healthier climate policies, in terms of where I think the US did a really good job under the Obama administration was identifying political champions within government and using legislative levers. So as I've already flagged, they were able to pursue more ambitious climate policies through using an existing legislative lever, the Clean Air Act. And you can see on the right there a graph which demonstrates between 1970 and 2018 how they were able to reduce air pollutants and still decouple those from economic growth. Although I do note there that there's about a 20% shift in CO2 emissions in the wrong direction as under this particular legislation, although they do come down with the implementation of the Clean Power Plan from 2015 onwards. In terms of political champions, so the way that the Obama administration approached the publication or announcement of their climate policies was to actually engage the US Surgeon General, who talked about how important this was for the public. And I think that was a really strategic move and demonstrated, I suppose, commitment from the top to seeing this through and using health as kind of a key selling point, really. I just wanted to quickly acknowledge the advocacy efforts that have happened in Australia, particularly through CAHA and DEA, so the Climate and Health Alliance and Doctors for the Environment Australia. They're by no means the only groups working to move forward and try and integrate health into, or to help health gain political traction in climate policy development. But the work that they have done, tireless efforts over the last decade in particular, I think have been really helpful in helping us to get to where we are today. I won't run through this in any major detail because I've got 2 minutes left before I'm going to finish up. We can certainly come back to this in the discussion if it's useful, but I did, as part of my PhD, identify factors that do seem to influence the political traction of health co-benefits. So it does obviously depend on what your energy fuel mix is and key domestic industries. In Australia, extractive industries are major exporters and contribute significantly to the economy, which provides a potential barrier for us here. Government priorities and agendas, political short-termism, the problem framing of climate change, which we've already discussed. Decoupling of air pollution and climate change mitigation policies, which we can talk about in Q&A if there's interest and time. The types of policy measures being pursued, so those that are more are less regulatory or probably make it more challenging to quantify the health benefits that you'll see. Evidence-based underpinning the policies, political leadership, public attitudes. I don't think there's anything profound there. So I'll keep moving. So then based on where we currently are, what strategies are at our fingertips for developing healthier climate policies? I think there's a lot of work that's happening in terms of reframing at the moment to focus on the benefits and opportunities that action affords. We see that with the establishment of the new Superpower Institute in South Australia, for example, which obviously focuses on energy, but led by Ross Garno and Rod Sims. And I think that we can really push health as an additional area where we can focus on the benefits of action. Super important to focus on integrated policies and a policy mix, so a suite of policies and interventions and measures so that we make sure that we're not leaving anybody behind. I think that, and this is a controversial perspective, but I think we do need to try and engage positively with industry in terms of trying to highlight for them the benefits that do come, including in relation to productivity, acknowledging that, that won't, in reality, that won't win over industry and business, but at least I think demonstrates to the broader public that there are benefits to business and industry, potentially shareholders, that this is in government interest or business interest to move forward. And in terms of institutionally, we definitely need to think about ensuring we've got health in all policies when we're developing. Very quickly, I'm sorry, Megan, and then I'll be quiet. Where I think we can really focus our efforts and energies is on advocacy coalitions. So there's been a lot of advocacy efforts happening in relation to health and environmental groups. I think we can extend that into energy groups as well and build our advocacy coalitions as a way to kind of counter the dominant force of extractive industry lobbying. Capacity building, particularly within government, I think is critical in making sure that not only those charged with responsibility for climate and change and health policy are have the knowledge and resources that they need, but more broadly, both within the health department and beyond, making sure that there is knowledge about climate-related health impacts, and being very clear about what indicators we decide are important to our society in terms of focusing on beyond the kind of the dominant economic indicators. On that, I will finish and I'll stop sharing my slides. But thank you so much for providing me with the opportunity to discuss this today. I'm looking really forward to an interesting discussion session. Please feel free to contact me with any questions or any suggestions, constructive criticism or feedback. And I'll leave you with this cartoon, which I really enjoy, from PET from 2009. What if it's a big hoax and we create a better world for nothing? Thank you very much. I will stop sharing slides and look forward to a discussion.
Lovely. Thanks, Belle. That was brilliant. I'm sure there'll be lots of discussion now.